and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let's pray. Our dear Heavenly Father, it's once more again we come before you, Lord, with the business at hand. Lord, we ask you to bless each and every one here tonight, Lord. And Lord, let everything be done for your glory, Lord. Not for no outside show to the world, but Lord, for your glory, that we may be one accord. In your name we pray. Amen.
Amen. Amen. Thank you, Commissioner Hunt, for the pledge and invocation. Now, mic on.
Yeah, mine's on. Might be muted, you.
Uh-oh, we're not at the bottom.
You don't know.
He's tore it up, Chris.
Let me get there. Oh, sorry.
Just like a man ain't working, he just pulled on it, right?
There you go. Stop right there. Just connect.
That ain't the mic on that can't be.
I guess he was telling me I was talking too much. Thank you, Mike.
Praise the Lord.
Thank you, Chris. Again, welcome you to our meeting tonight. It's good to have other elected officials in the House. I see some school board members, Ms. Jessie from the newspaper, and Mrs. Catherine Blue as elected official. Are there more in the House? Ms. Angela Sutton's in the House. Thank you. Thank our elected officials for being in the House with us tonight, school board members. Again, we'll get started. I heard a motion to adopt. Are there anything need to be tabled, pulled, or added?
Mr. Chairman, I make a motion that we adopt the agenda as printed.
There's a second?
I second it.
Motion second, we approve as printed. All had time to consider. All in favor of the word aye? Aye. Opposed, I have it. We do have it approved. Item number 2 is consent A through I. Do any of the board members have any concern about any of the items from A to I? If not, I'll take a motion to approve. So move. The second?
Second.
Motion second, we approve A through I. All had time to consider. All in favor with aye?
Aye.
Opposed? I have it. Ms. Dudley, Tax Administration. Straight up.
Good evening. I have a few things for you this evening. First thing, of course, is my report. Tax collected for the month of April. Current year was $240,803.49 at a 95.96% rate compared to a 95.95% last year. Prior year's collected was $76,554.64 at a 53.11% rate compared to a 53.23% rate last year. Total collected for the month of April was $317,348.13. Next, I have a couple of releases. Have a mobile home that was double listed, a piece of property that the grade was adjusted, a boat that was listed in error, some other errors that were made on a property of Ms. Faye Holiday, and a DOT bill that was billed to a customer for 2024, but the DOT had took possession of that, and then 2 bills that were billed in error for a total of $2,839.61 to be released and refunded.
There a motion to release those funds?
So moved.
A second?
Second.
All the time consider, all in favor with aye? Aye. Opposed, I have it. Release the funds.
The next I have is a request from Ms. Jackie Rogers. I submitted a letter to you concerning Ms. Rogers. Ms. Rogers came to the tax office in 2024 asking for an exemption of church. And she was told that she was too late, but she was also denied the opportunity to bring this before the board and ask for this to be released. So when she came to me, I told her I still could not release it, that she had to bring it before the board. I did see Ms. Rogers here this evening.
Ms. Rogers? Okay. We good, just make sure it's in the building.
So I just wanted to see if you would grant her and her church, it is putting a financial strain on her church to pay that bill. She has been working on the bill, but the total bill was $2,941.11. And she has been trying to pay the bill, but she would like to see if you would grant her this application. She did put in the application for 2025, so the church will not receive a bill for 2025, but they still have the tax.
Outstanding bill for 2024.
Excuse me.
She still have the outstanding bill for 2024?
Yes, sir.
Mr. Chairman, I make a motion that we waive that fee of $2,941.11.
The second?
Second.
Motion second, waive that fee for the church for late filing. All had time to consider. All in favor with aye? Aye. Opposed? I have it. Waive it.
The next thing I have is a late application for a land use for Mr. and Mrs. Andrew Miller. This was something that was left on the desk, and I did not have any kind of way of contacting the Millers. So they're not here to speak tonight, but this was on the desk, and after digging through it, they did have an application, and they did have an application for 2025, but in 2024, when this property was sold to them, they were not contacted. They said they did not know of how to apply for this continued use. So again, I'm asking for permission to grant them the permission to continue the use on their program that they have for their land that they bought.
Okay, wish of the board.
Is this, just a minute,
Good,
Mr.
Tony.
Chairman. I know you're wide open
Yeah.
tonight. Is this the land use on the, for this property? Is this, this is something, a program that they're running that allows them to set the land
It's
aside
farming.
for you?
So they're farming the land. They bought land that was being farmed.
Right.
They are still farming the land, but they didn't know that they needed to apply to
For it to
continue
be
using it.
listed as farmland?
Yes.
I got you, okay, all right. Thank you. I'm good, Mr. Chairman.
Okay,
I'll make a motion to approve if you're ready for a
I'm
motion.
ready. The second?
Second.
Motion is second to approve. All time consider. All in favor with aye? Aye. Opposed? I have it. Approved.
And the last thing I have before you is some surplus property. This was a piece of property that there was some issues with it. We had to have a survey and done on it. So it is for a lot on Cheer Lane. It is on our tax book as on the website for a total cost of $4,444.21. Tax value of it is $5,320. So I asked for permission to put this on the website for sale.
Wish of the board.
Make a motion to grant Ms. Dudley's recommendation.
Second?
Second.
Motion second, we're going to have a recommendation, all had time to consider. All in favor with aye? Aye. Opposed? I have it.
Thank you.
Thank you.
Thank you, Ms. Dudley.
Hope every change service hats, they in the building, Tish? She's coming? Okay.
Good evening.
Good evening.
Because we're a sub-recipient of 5307 funds, we are required by FDA regulations to have a public transportation agency safety plan, also called PTAS. HATS PTAS was last approved at the commissioners' meeting on June the 21st, 2021. Since the last approval, we had a couple of changes in our staff, so the plan had to be revised to reflect our current staff. Additionally, FTA has issued Directive 21-1 requiring all public transit agencies to conduct a safety risk assessment on frontline transit workers assault and to include safety risk and mitigations to ensure appropriate measures are being taken to protect transit employees. The plan was sent to NCDOT for review in their recommendations, and they added some additional language to it before sending it back. The suggested changes were made prior to sending it to Attorney Hunt for approval. We're requesting to have approval so the plan can be sent back to FTA, the security funds.
Attorney Grady, you pleased with the language?
It's good.
Good language, not much change to it?
Basically, including some provisions for assaultive behavior on the employees.
Yes, sir.
Biggest change other than the names of the personnel.
Yes, sir.
Okay, all right. Wish of the board.
Mr. Chairman, I'll make a motion that we approve the Public Transportation Agency Safety Plan.
Second.
Second.
All had time to consider. All in favor with aye? Aye. Opposed? I have it. Approved. Thank you.
Thank you so much.
Hope County Juvenile Crime Prevention Council. That's the board I serve on, very good board. Good
We
evening.
have a simple request tonight. We have 4 individuals that we're recommending for membership, and we need your approval. The first 2 are designees. Ms. Edens has asked Garvin Ferguson to represent her on our board. Michael Harden, our district attorney, has asked Ms. Kristen Crow to serve on our board. We have a student, a college student named Janiyah Pittman, who would like to serve. She's involved in teen court here. And King Blue would like to serve as our juvenile attorney representative.
Very good
That would
board.
be for July 1 for the next 2 years.
2 years.
Yeah.
It's a very good board. It's hard to get folks to meet in the middle of the day's board meet at 1 o'clock. And most folks is, like I am, is at work at 1 o'clock during the day. So very good board, and to get folk to serve on it, it's an honor. So certainly,
Mr. Chairman, I make a motion for,
Thank you, Tom.
University attorney.
Mr. Chairman, I make a motion that we approve the said names for the Hope County Juvenile Prevention Council.
Yeah, second. Motion second, had time to sit on it with aye. Opposed, I have it. Didn't know where I was going. I get ready to fight for it. Thank you.
Thank you.
Tony, help us out on
Tony knew where I was going. Number 6, Troy Eunice coming at this time.
Good evening.
Good evening.
Thank you so much for having me in, Chairman Leach, Commissioners. And I am here to present our annual report to you all. So just a reminder, obviously my name is Cecilia Pierce. I'm the Regional Vice President for Trillium Health Resources. The region is our southern region, so Hoke is a part of a 9-county region, one of 5 regions that we've designated in our catchment area. Trillium is your local management entity and managed care organization. So in essence, we are a public specialty health plan, primarily serving people who receive Medicaid and have the highest mental health, substance use, and developmental disability needs. We also provide state funding for people who have no insurance or are underinsured and have behavioral health needs. So just want to review our mission. Our mission is transforming lives and building community well-being through partnerships and proven solutions. We know that when members get access to care at the right time, at the right place, in the right amount, it can really transform their lives. But we do need those partnerships. Part of the reason that we're here, that local management entity piece, is that county stakeholders and departments, we consider all of them our partners, as well as our members and our providers. We also focus on those proven solutions, so those best practices that maintain the fidelity to the models of care that we have seen to be very effective in serving our members. So once we completed the consolidation that happened early in 2024, we are now a 46-county region, 46-county catchment area. If you look at the map here, we have a total population within our catchment area in green of about 3.1 million. That compares to our neighbor Alliance, the closest tailored plan, in pink. So their population is 3.5 million. So you can see that we are looking at the same population but spread out among a very large area of land. So our approach to working with our providers and providing services has to look different in order for us to get that care out to our members. And here's a summary of that population. So we have around 51,000 tailored plan members, and I'll talk a little bit about tailored plan and Medicaid Direct. The majority of our members are still part of that Medicaid Direct service line, so that's people just receiving those behavioral health services through us, receiving physical health care through another health plan. And then we are still serving around 287,000 people who are either uninsured or underinsured and needing behavioral health services through us. So I mentioned those 5 regions. Really what we're trying to do in designating regions is focusing on smaller areas of our catchment so that we can maintain our local connections. We know that covering 46 counties is a lot. We don't want any county to be lost, and we don't want the focus on any one county over another. All counties have similar needs, but in different volumes, and need services in different ways, and there's different cultures and dynamics in every county. So we want to have staff that are working locally in your county and working with our appointed board members and our consumer and family advisory committees to make sure that we understand the needs of the county and you all are understanding what we're doing, the services that are provided so people can access care. So to that end, we have a regional advisory board in each region. Commissioner Leach is our appointee to the regional advisory board, so we appreciate your service on our board, as well as Ms. Jackie McLean, who serves multiple roles here in the county, multiple hats. She's part of our CFAC, as well as obviously a local council person and connected with the school district. I'm serving as your regional vice president. We have a director of community engagement and empowerment. His name is Terrell Alston. He's available to work alongside me in getting to meetings and county events. And then we also actually have Crystal Morrison. She's not up on the slide because she's fairly new to our team. She's a community liaison as well, attending meetings and events and staying involved in things that are happening here. So just to dive into finances from last year, so our total revenue from last year was a little over $1.2 billion. You can see the majority of that revenue was from Medicaid services. We did have some money going into our risk reserve. That's a requirement from the state per our contract. About 10% of our revenue goes towards those state-funded services for people with no insurance or are underinsured for their behavioral health needs. And then each of our counties is contributing to mental health support initiatives and services that are not funded through Medicaid or state funds. And we also receive some other funds through the state, through block grants and special projects that are designated for us to administer. And then we also receive some administrative costs or revenue to be able to manage our contracts, to be able to provide oversight, things like our member and recipient service line, tailored care management, and activities like that. And that amounts to around 11.5% of our revenue. So one of the things that is going to look a little bit different with this annual report is that we launched the tailored plan, which is our whole person plan of care, in July of last year. So we really wanted to take a look at the numbers starting in July of last year versus the entire fiscal year, just to give you a better idea of where we're at with our tailored plan population and our total population. So we served around 80,000 unique individuals that had severe behavioral health needs, and substance use, intellectual developmental disabilities falls under what we're calling behavioral health needs. And so you can see the breakdown. Around 63% of those individuals were served for a mental health concern, around 17% were served for substance use needs, and around 20% were served for an intellectual or developmental disability. And then the total value just in that first 6 months for claims that were billed to Trillium from our providers was a little over $802 million. So we expect that to, essentially double or greater towards the end of the fiscal year. And so I mentioned tailored plan. We've been in the process with North Carolina Department of Health and Human Services through Medicaid transformation. So that's allowing people who are receiving Medicaid, who are not carved out of managed care, to have their physical health needs and behavioral health needs served under one plan. So that started with the launch of the standard plans in July of 2021. Those standard plans are serving somewhere between 70-75% of the Medicaid population. And those are the individuals who have mild to moderate behavioral health needs and can have their needs met through basic outpatient services and maybe some medication management. So those plans you'll see on the next slide are listed. The second phase of that Medicaid transformation process was the launch of the tailored plans. So those are the 4 LME MCOs that started their tailored plan benefits on July 1st of last year. We did experience some growing pains during that process, just with the launch of any new service or line of business. We had a very high call volume on our member and recipient service line, and it has taken us a while to get down to our metrics in terms of being able to respond to those calls quickly, not have calls dropped, that sort of thing. So that has taken us a while to make adjustments and get everyone the information that they need so that call volume gets steadied at a regular pace. And that's happened over the last couple months. So that first 6 months was really an adjustment period. We also knew that there would be challenges around the non-emergency Medicaid transportation that we provide under that tailored plan. Our members were moving from scheduling their appointments with departments of social services to scheduling their appointments with us through Motive Care, who's our vendor for transportation. So we have been working very diligently with Motive Care on each individual need to make sure that the needs of our members are covered, not just to get them where they want to go, but to get them going there in the way that they feel safe and it's their preferred method. And we've had to work really closely with Motive Care to troubleshoot some of those things. So the last part of that process, obviously we're close to our first year of operation of the tailored plan. The last part of that process is the launch of the what the state is calling their foster care plan. It's the Child and Family Specialty Plan. And so DHHS went through an RFP. They chose Blue Cross and Blue Shield to operate a statewide plan to serve every child who is involved in foster care or has aged out of foster care but is still getting support as a former foster child, as well as their families. And so that plan will launch with children in foster care in December of this year. And that will be a single statewide plan that will cover both those basic services and the enhanced services that tailored plans are covering now. So just a little bit more information around the individuals that Trillium and other plans are serving through Medicaid. In our catchment area, we are covering around 28% of those members, with those standard plans covering around 72% of those members. Healthy Blue is the provider or the healthcare provider that is covering the most number of those Medicaid members throughout our catchment area. And then in terms of numbers in Hoke County as of December of 2024, there were around 20,000 individuals enrolled in Medicaid at that time. We are serving around 24% of those members. 6%, or around 1,200, are part of that tailored plan, so we're covering their physical health care as well as their behavioral health care. And then 18% are still part of that Medicaid direct service, so they have been carved out of managed care by Department of Health and Human Services, typically because they receive Medicare, and that's their primary health insurance. Other folks are enrolled in different plans within Medicaid, and they're carved out of managed care. And then you have your primary standard plans here in the county. WellCare has the largest share at 19%, closely followed with Healthy Blue, United, and Carolina Complete Health. So some of the things that we have been working on over the last year, we were very excited to launch the Child First service. That was a service that we put in place in Trillium's catchment area prior to the consolidation, and we worked with Easter Seals to expand that service into Hoke County. We have another provider that has expanded throughout the mid-state region as well. And so we are very excited. That's a 0 to 5-year-old early intervention service. And that's really designed to help stabilize families. When a child has been diagnosed with some sort of disability, we know that can wreak havoc on family life, and it can throw parents and the household for a loop in terms of how to support their kids and get them ready for school and connect them to needed services. And so that's really designed to help support that family early so that they can be prepared for school and we can avoid out-of-home placements later on and avoid involvement with the juvenile justice system. Also, we have been hosting, we continue to provide CIT training, and we've hosted a Supporting Children Early simulation event here in the county. And that's really designed to help build awareness around some of the barriers that parents face when their child is diagnosed with a disability, some of the challenges that they experience navigating multiple systems, healthcare, jobs, childcare, those types of things. We have partnered with the state to offer a recovery app for people in substance use recovery, and that's called Chess Health. So members can get connected to that app through their provider and receive additional support around their recovery plan. So it's just another tool in your virtual tool belt to support your recovery, get access to recovery information, meetings, and then connect for additional peer support or send an alert to your provider if you think you might have a slip in your recovery and you need some extra support. And then one of my favorite programs that we continue with is Victory Junction. So that's an inclusive camp in Randleman. Our members have access to that for a family weekend in the spring and the fall. And it really allows our families where a child, whether it's an adult child or 0 to 18-year-old, to have the opportunity to go to camp when sometimes their different abilities keep them from going to a traditional camp setting. It also provides the family with a little bit of respite and opportunity to just relax and have fun outside of their typical home environment that can be demanding when you're family caregiving for someone with a disability. And then just to get to some numbers of people served in Hoke County. So last year, we served a little over 1,000 members in Hoke County. Around 64% of those individuals were served for mental health conditions. 24% were served for intellectual and developmental disabilities, and then 12% were served for substance use needs. And in terms of the numbers, there is some overlap because, as we know, people don't just experience one concern. They might have mental health and substance use. They might have developmental disabilities and mental health. They could have all three concerns all at once. So there's, if you added those numbers up, it would total more than 1,024. And then the value of services provided was a little under $11 million in the county within the last 6 months, or the first 6 months that we were operating as a tailored plan. And then we also want to make sure that our members and the general public know how to get a hold of us. So our member and recipient service line is our general number for our members to connect with us if they need to find provider information, they have questions about their benefits, and that's available Monday through Saturday, 7 a.m. to 6 p.m. If someone is experiencing a behavioral health crisis, regardless of what health plan they have, they can always call Trillium. We have clinicians on staff 24/7 to help assess that need and connect them with resources to help with the de-escalation of the crisis or to make sure that the proper supports are coming to them for help. And then obviously, as part of that process, we assess the urgency of need and then get folks connected with the right providers. And that's all I have for you this evening.
Any board member have any questions?
Just one, Mr. Chairman. Ms. Pierce, again, thank you for talking to me several times about expanding Medicaid services in the whole county. Appreciate the conversation. But in addition to where we're going forward with the issues addressing funding from the federal government down to the state level, to the local level, do you see a increase or decrease, or right now, what do you see in terms of funding now?
We are keeping a very close eye on funding. I think one of the biggest concerns is that with adjustments to provider taxes, it may reduce the amount of match that we're able to get from the federal government to support Medicaid expansion. And so if we don't have that funding to continue with expansion, then we will see more people who do not have that full set of benefits through Medicaid and are accessing a very, very limited amount of money coming from the state for people who are, again, uninsured or underinsured and have significant behavioral health needs. That funding from the state for people with no insurance, that funding amount hasn't really changed for the last 10 or 15 years, except the needs have gotten greater. So Medicaid expansion has really been very helpful in providing more robust services and access to that care earlier on. People with no insurance often wait until they run into a crisis to try to access care. And that's one of our biggest concerns.
Okay, thank you.
Thank you.
Thank you.
Thank you for coming. Hood County Corporate Extension. Mrs. Daniel. Good evening.
To the best county manager in North Carolina, County Manager Ms. Edens, and the Board of Commissioners, thank you all for allowing me to be here again this year. So I am the coordinator for Hope County of the Governor's Volunteer Service.
Okay.
So I am the appointee for that. And today, I would like to say that for our Governor's Award, Volunteer Service for 2025, we have recipients, and it reads, they are hereby awarded the highest designation of appreciation for distinguished volunteer service to the people and the state of North Carolina, and is to be granted and extended all honors and courtesy provided by this office entitled thereunto by this certificate of recognition and appreciation. And these recipients are Mrs. Betty Perkins
Is she here? Come up, Miss Betty.
and Mr. Caden Jekyll.
Come on up.
So,
Let's go,
Ms.
folks.
Ellen McNeil would like for you to know she desired to be here, but she has company and she finished up tonight. So she nominated.
Put in your mic, sweetie, so we can.
Oh, so Ms. Ellen McNeil would like for you to know that she wished to be here. She volunteered you. She nominated you, but she has company. She said, let you know she would be here, but because of that, she cannot. So, and Ms. Jekyll, would you come up? You're welcome. And you also have a pen. Okay. And Caden, thank you for your volunteer service in Hope County, and he's also a 4-H'er and a Boy Scout. So thank you. Ms. Matthews nominated you for your award.
Come on, baby. Let's get a picture. Make me look great.
You're a little tall.
Keep smiling.
Thank you, man. Thank you, congratulations. Thank you. Appreciate it. Thank you, congratulations. Look at the fact you did it.
Good job. Good job.
Thank you so much. It's good to have citizens to do good and to do well by volunteer helping others. That's what it's all about. Who have you helped lately? So thank both of y'all for working so hard to help our citizens and volunteers to do things they're not able to do for themselves. So that's great when you can help others. A certain local government say tonight to each of you, thank you for a job that was well done. You've done great by serving others, and certainly you will be rewarded back for that when someone may have opportunity to serve each of you. And you can think about you serve others, now they'll serve you. So thank you so much. Keep working, and thank you for what you do for Hope County citizens. When you do it for them, you do it for us. Thank you. All righty. Okay. Hope County Public Library Board of Trustees, reappointment. Mr. Harrod, that's your board, I believe. Come up.
Yes, sir, it is. Hello, I'm Whitney Simmons. I'm the library director. This is Jennifer Hatcher. She's our regional library assistant director.
Okay.
And I do want to take a minute before we get started to also shout out Miss Betty. She's on our Friends of the Library. She's the president. She's also on our library board. She does a lot of work for us.
Yeah. Keep working, Miss Betty.
So we have three members of our board that are up for reappointment. Terrain Francois, who's also our chairperson this year. LaRonia New, who's also serving on the regional board, and Barbara Randall.
Okay.
Her appointment ends on June 30th, and we're asking that they be reappointed beginning July 1st, 2025 to June 30th, 2028.
Mr. Chairman, I serve on that board, and to you and the board members, these people do a great job, great services like Ms. Perkins, and they asked to be reappointed, and we would love to have them back on the board. So I'd like to make that as a motion.
All right. That's second? Motion second, reappoint them. All had time to consider. All in favor, would aye? Aye. Opposed? I have it. Tell them thank you for the service they do, job they do. Thank you. Southeastern Economic Development Commissioner Board, reappointment of Mr. Will Wright. Tish, you have that one?
Yeah, I'll handle that one. I was notified by the Southeastern Economic Development Commission Board that we needed to reappoint Mr. Will Wright, our economic developer, for this board. Gwen McGugan was also on that board, and I'll be bringing that one back to the board. You will need to reappoint someone in her position also, sir.
Okay. Mr. Will Wright for Southeastern, what's the?
It's for April the 1st, and it's for 2 years, if I'm not mistaken.
Okay. What wish of the board?
I move that we reappoint Will Wright to the Southeastern Economic Development Commission Board.
I second this motion.
Motion second, all right, time to consider. All in favor, would aye?
Aye.
Opposed, I have it. Thank you. Mrs. Catherine Blue, you come and present your superintendent.
Good afternoon,
Good afternoon.
Chairman Leach, Vice Chairman Sutherland, to all the commissioners. It's an honor to stand before you tonight to introduce Dr. Kenneth Spells. Everybody know him. He's been with us for almost 2 years now. So if you don't mind putting your hands together for Dr. Kenneth Spells.
All right.
And Dr. Swell, you got to live up to that. Thank you so much.
Well, thank you, guys. Thank you, Mrs. Blue. And I want to thank the Board of Commissioners for your hospitality tonight. And I have Dr. Hunt with me also, Dr. Chad Hunt. I wanted to just take a few minutes and talk to you about our big, beautiful locker room project. And we want to get this locker room project completed. So tonight, we are standing in front of the Board of Commissioners to request $115,000 from our savings from fiscal year '24 to complete the projects at West Hoke and East Hoke. Now, we've already completed the floors, the shower walls, and the lockers, and we want to complete the doors and the benches. So we need 12 benches at East Hoke and 12 doors at East Hoke and 12 doors at West Hoke and 16 benches. And this will finally complete our big, beautiful locker room project.
That's where, will this be completed by June 30th of this year?
Dr. Hunt?
Yes, sir, that's the goal.
See, what happened, most of us understand what happened when we do your cap outlay and give you dollars, if they're not used by June 30th, they convert back into the Hope County fund balance, I think. That's where it went. So that's how you lost some dollars.
Correct.
By not using them by June 30th. You're asking to, there's no new money. You're asking dollars already been granted to the school board to be able to finish up these projects. And you don't want us converted by June 30th. You need to use it by June 30th.
Correct.
Okay.
Correct. And the locker rooms are looking good, too.
Good. Any questions from the board?
What projects are you moving the money from? Where are these savings coming from?
Would you like a total breakdown for each individual line, or just
Or just a broad description of where the,
So we had savings on the canopy replacement at Hawkeye Elementary School, the septic system over at Rockfish Elementary School. There was a small savings with the fence installation at West Hope Middle School, the flail mower that the maintenance department purchased, and then there was also a small amount that's coming from both projects, from the roof repairs at J.W. Turlington Cafeteria, also over at the maintenance building. The transportation roof repair had a savings, as well as looks like the Chromebook refresh had a savings as well. There was some small savings over at the plumbing that was updated at Upchurch Elementary School. The HVAC replacements at Upchurch Elementary School, a very small one with the classroom door lock upgrades at Rockfish Hope, and also another small one at Sandy Grove Middle School. And that total came up to approximately $115,000.
115.
Mr. Chairman.
Yes, sir.
Dr. Hunt, on all the savings that you called out, on all of those, you said that they all are savings. There was none of the work cut out. It was just savings from it coming in under cost. Is that what it was?
Yes, sir, that's correct.
Okay, thank you.
and the locker room projects, did they come in over budget from what we allocated initially in the capital outlay budget?
No, sir, those came in under budget. I can't tell you how much West Hope Middle Schools came under budget so far, but over at East Hope Middle School, approximately right now, is somewhere around $45,000.
Under budget?
Yes, sir.
Well, Mr. Chairman, I took a tour of the project, and it's like you said, it's almost completed. Madam Chairwoman, Ms. Blue was on our backs about making sure that we do a good job. So I think that the money, first of all, the Board of Education, the Superintendent, Dr. Hunter, y'all did an excellent job in finding savings. Anytime you can find savings, we can do more for our students. Mr. Chairman, I'd like to make a motion that we, I'll let that question first.
Yes, about the fencing, is that the gate fencing at the drive-through? Is that going to be replaced? Because I know it was removed, but nothing has been put back at East Hope.
Mr. Manis, is that on our upcoming project? That's on the list of upcoming.
Okay, thank you.
Okay.
Mr. Chairman,
Yes, sir.
I just got another question I want to ask. The question was asked about the budgets on the two middle schools. And I think you said that East Hope came in under at 45,000. Is that what you said, Dr. Hunt?
Yes, sir.
Okay, so if you're under budget, why are we having to add more money? I'm just curious. In other words, you said that well, allocated so much money for the project, and you said in your statement that you were $45,000 under budget right now at East Hope Middle School. So my question is, we're adding more money, and I understand what Dr. Spell said we're adding it for, but was those doors and other things not part of the original budget?
Yes, sir, that's correct. The doors were not part of the original request. It was simply the lockers, the flooring, and the shower walls.
Okay, so what we're approving to pay for now, we would normally call it a change order because you're adding additional items to the work, right?
Yes, sir. So
Okay.
there's approximately $45,000 in savings, like we just said.
Right.
By the time we calculate the doors and the benches for both for that school alone is somewhere around $53,000.
Okay, I understand. I didn't understand if the doors and the benches and all were part of the original, but they're not. There's things that you've added. That makes more sense to me now. Okay, thank you, Mr. Chairman.
Yes, sir, and you just want to make sure that you spend all your capital outlay money.
Correct.
You don't want to return it back to us.
Yes.
I don't think that's what he said. That's not what he said.
It's needed.
That's right.
Just checking. Just checking.
That, these locker rooms are locker rooms that's typically used by visiting teams. Am I correct, Dr. Hunt? They normally,
Both home and visitors, yes, sir.
so they're used by, a lot of times, all of our visitors come in and see the locker room, so sometimes they had needed to be repaired. So I think the money, and so far, I think you're probably about 85-90% complete. It looks really good. I went there and took a tour with the principal at West Hope Middle. But that being said, Mr. Chairman, I'd like to make a motion that we accept the recommendation of the superintendent.
Okay, a second?
Second.
And also, it makes a big difference for what you see in person when you walk in. A good environment and a clean environment makes a big difference. So it makes a big difference, a good clean environment. And you can't clean old stuff when they rot it out, gone to the bad. So a motion second approval, I time to consider. All in favor with aye? Aye. Opposed? I have it. Spend your money.
All right, hey, thank you. Thank you very much.
Dr. Spell, you know Jim 30 about a month off?
Yes.
Thank you. Ms. Manager, it's your time. You still here?
I would like to ask the Hope County Emergency Services to come up. Scott and your guests. I met with them last week, and we meet a lot, me and Scott. We're always talking about what Hope Emergency Services does for Hope County. But they've brought some new things that they are doing for the county, and I'd like them to give you guys an update.
All righty.
Because they're always updating me on what they're doing and what they're proposing for the county. So I thought the board should hear that also.
Thank you. First off, before we get started, I'd like to introduce my boss, Mr. Brian Langston.
Thank you.
Corporate Director of Mobile Integrated Health. You'll remember Mr. Pierce, who was my boss. We now have added a layer in between. So if there's anything you'd like to say really quickly, I'd give you the opportunity just to say hello.
Sure. Brian Langston, Capability Health.
Thank you.
Appreciate the opportunity to serve Hope County. Appreciate you having us here for your county commissioners meeting and granting us time. We'd like to recognize that this is the start of EMS Week nationally. Also, we recognize our EMS.
So, you know, if you, we'll get you the mics, I'll get you the minutes.
Yeah, use
And
it.
Brian, I'm happy to have you take that mic with you when he's finished to get you in our minutes.
I'm just staying out of his way.
Okay.
Brian Langston, Corporate Director of Mobile Health at Cape Fear Valley. Just wanted to say thank you for the opportunity to come and share what we do for the community here in Hope County. And again, to recognize our EMS professionals as EMS Week started on Sunday. It's our chance to recognize our pre-hospital professionals across the nation. And this year's theme is We Care for Everyone. And I think what you'll see through Scott's presentation is just that and the services that we provide here. So thank you very much, and I'll turn my time back over.
And thank you for taking care of people when they need to go to the hospital.
Yes, sir.
Thank you, sir. I just wanted to give him a chance to speak.
I got you.
Also like to introduce Captain Locklear, who is our training officer. Tim comes to us in the fall of last year, and you're going to see the impact he has had already within the county. Also, since Trillium's here, we also participate with the CIT team, so we go to training through that as well, and we've also added Carter kits, which I'm sure you're familiar with. This is something that we're training on that will help us better interact with especially young children who have intellectual and developmental issues as it relates to autism and other health care issues where they don't communicate well. This will give us a tool to use to interact with them and hopefully make them feel much more comfortable in the EMS environment. And Commissioner Leach, to my knowledge, nobody directly around us has those, so you are first in that
Are we
regard.
first?
Yes, sir.
We first again.
I know you like that.
I like that word. I like to be first.
So that's just another piece of a tool we're adding to our service to service the community.
Thank you.
So with that, some of the things that I want you to see that we're doing kind of behind the scenes. You see us out there every day running EMS calls, and so you know that's getting done. But there's some other things that we do that you may or may not be aware of. Such as and you are aware of us donating AEDs to some of the fire departments, but we've also donated some other AEDs we're going to talk about as well. Tim has been very aggressive in teaching CPR and first aid to all of our neighbors in the county, our partners, and we've even had some requests to do some additional CPR training for other members of our community. And we also help cover some of the special events in the county, and I'll kind of show you a little bit about what we're talking about, and I promise not to go very long. So here, you know our sheriff, I like to give him a little positive every now and again, but we donated an AED to the courthouse. Through the race cars program that you're familiar with, we've had the race cars team here to speak with you, but because we participate, we're allotted so many AEDs, and we've distributed those into the county where we feel like they're needed and where they can be best served. So the county courthouse will be getting one when that's completed. Rayford PD, we gave 2 to Rayford PD so that every shift has an AED that's on duty. So every night, every day they're on patrol, there's an AED floating around the city that just may be closer than we are to a cardiac arrest. And so we feel like that's very important to get that AED there quickly. So we donated 2 to Rayford PD. Parks and Rec, we donated an AED to the park on 211, which I think is part of Commissioner Leach's broad Parks and Recreation initiative. But the park on 211 now has an AED at the center office, kind of the concession stand area, whatever that little section is called. There's an AED there. We have one in downtown Rayford. It's out in front of Stewart's. If you're walking up in downtown, you may have seen this box sitting out there and wondering what it was. But it's an AED that any citizen can use. You only have to know one step, and that's to be able to turn it on. If you can turn it on, it will walk you through everything else that needs to be done. We felt like this was really important with the number of events that you have downtown Rayford. It's also in a very highly populated area. And if there is an emergency right there, dispatch is familiar with the location of all of these AEDs, and they can direct somebody to grab that AED while they're dispatching us. So we felt like it was very important to have one downtown with the festivals and stuff that go on. We also donated 2 to the Carolina Horse Park. It's a fairly large facility they have out there. They're not required to have EMS coverage at all of their events, and so we felt like putting 2 AEDs out there would be very beneficial with the number of people that are there. And again, this is just another way to have that resource close by if they have a medical emergency there until we can get an EMS unit on the scene. The fire departments that we've donated to already, you were part of that before, with the exception of Miss Mary. I don't believe you were on the council at the time we did this, but North Rayford, Stonewall, Pine Hill, South Antioch, and Tylertown have all received AEDs donated through the Race Cars program, which now all the fire departments, if I'm not mistaken, Chief, all have AEDs now. Is that correct? Yes, sir. So that was very important to us that they have those available. Some churches that we've donated to, I wish we could get more to do that, and we'll continue to try to work on that. But Rockfish Church has a location that's on 15501. If you're familiar, that's kind of on the very edge of the county. It's also a good ways away from the closest ambulance. And so we felt like that was very much served with a great place to have one if they have some gatherings. And then Piney Grove Church has received one as well. CPR training. Captain Locklear has been in the school system, working out at Sandy Grove, among others. Where else have you been, Captain?
Cook County High School was actually in the beginning stages of getting every teacher, from teacher assistant to teacher to
You beat the mic, you can do a whole speak.
hands-on CPR training and AED training. Since they only have one on the campus, I feel it'd be safe for everybody who is a
What you need most is action we take.
school system to be trained in
What they need most in the mic is the action that we take.
So I'm working with that done across
Right, they don't have to be
Cook
recording
County High School,
conversation.
all 3 middle schools.
They can break who spoke. Like who spoke, this person spoke.
So we're working very hard to get that training to as many people as we can. This training is also provided at no expense. So we're not charging anybody to receive this training. Again, working with some of the partners in the school system. And then they are presented with a certificate at the end that lets them be able to demonstrate to their employer that they have received CPR training and the use of an AED. So some of the other things that we're working on as well, you'll know that we are also partnering with we've talked about the Deputy Medic Program before, their training officer, Helen Christensen. Tim is partnering with her, and we're teaching hands-only CPR across the county. I think she has been to some of the fire departments to do some training. I believe she was at Tylertown, if I'm not mistaken, doing some training there with the fire department there. On our hospital campus, we've had training with all the hospital staff as well, and also during our 10-year celebration that the hospital was open to the public, we set up a booth and did hands-only CPR training and AED usage there as well. Several CPR classes. Tim has gone out to several churches and helped teach CPR. We've been asked to help with some of the doctor's offices in the county to assist with CPR training, which we're very happy to do. On 5/13, we did a downtown training event for the employees downtown. We had 19 people come to that training exercise to use that AED that is downtown. So if there is an emergency, we have folks that are trained as well. And then I'm very happy to announce that on June the 9th, Tim will be on the radio with our hospital president. They have a block on the radio station, and they'll be talking about hands-only CPR and AED training as well. We've also worked on a program. Tim has been very instrumental in this with WorkSafe facilities, and this is a project through the Race Cars program to certify that they have AEDs on site, they have people trained, they have an emergency response plan, and they're awarded a certificate when they become a WorkSafe facility. So far, Cape Fear Hoke and First Health Hoke have both participated in that, as well as Mount Elam Baptist Church. And we've also working with 2 schools currently, and I assume that's still underway. We're not quite finished with that. And we've also provided information to 13 other locations to work on getting that program started. I teach every year for the Public Utilities Department. We're actually scheduled to do that, I believe, next week or next 2 weeks. But we do a safety training with them and talk about some of the things that can happen. They called me and wanted to get this on the books. They've already seen a few snakes. And that's a topic that I cover with them and how to deal with that. If you come across it, dog bites, there's heat and weather emergencies. There's all kinds of things we talk about. So that's something that we do every year with that program. And again, no expense. It's something we do just to be good partners. So we cover the Rockfish Speedway. Whenever they have a race event out there, we provide EMS coverage. I was happy to tell you that Kyle Bush came out and trained, did a little workout there. He was kind enough to let us have our picture made with him, but I don't know the type of car that it is, but it's a smaller car. It's not a NASCAR, but it's a different type of vehicle, like a modified, I think is what they call it. But he was out there testing his vehicle, and so they asked us to come out and stand by, but we also do their regular events. The Carolina Horse Park, like I told you, they have events out there all the time. There are certain ones that are required by their rule system to have EMS there, and so we're there usually once or twice a month. And then, they have the big one in March that's televised all over the world. And so we're there with that as well to deal with any issues that occur. So I wanted to tell you we're doing all that while doing this. We so far, as of yesterday, have run 3,693 calls with an average response time of 11 minutes and 12 seconds and an average total time to turn that call around from beginning to end of 51 minutes and 29 seconds. Every day is busy, but for some reason Saturday and Tuesday are our 2 biggest days, just off the stats from the beginning of the year. And probably the biggest thing I want you to see is the time of the day. It starts about 7 or 8 o'clock in the morning and goes through until about 8 or 9 o'clock at night, and we are steady. And that is our peak period. And so I just kind of wanted you to see the data. That's from November to May, but it's still very reflective of what occurs regularly. And then our transport destinations, just some of the hospitals that we go to, so that you know we're trying to take patients where they want to be. But we go to Scotland, we go to Lumberton occasionally, First Health, Cape Fear as well, but we're working really hard to get patients to the hospital and get turned around very quickly. What's next for us? We're in the process of becoming CAS accredited, and Mr. Leach is going to love this too, because I got a number up there for him. I know he's a numbers guy, okay? We are in the process. We will be reviewed, I believe, in June. We have submitted all of our information. They have come down and done an inspection, and if everything looks good, hopefully early July, I don't know how long it'll take them to do it, but Mr. Leach will be number 8 in the state of North Carolina that is CAS accredited.
Okay, not bad.
So that would be a huge thing for Hope County to be able to say. If you look at who we're compared against, most of those are large areas, metropolitan areas. So if you look at this, we would be the first, maybe Rowan, some people may consider that around Salisbury rural, but I don't think there'd be anybody any more rural than Hope County on that list, and we are working really hard to get there. Any questions?
And North Carolina's number 7, correct?
Sir?
North Carolina's number 7.
There's 7 right now that are CAS accredited in the state, and we would be the 8th service in the state of North Carolina to have that recognition.
Okay. Sounds good. Work on it. Better service and better equipped you are will help our citizens. Sounds good. Thank you. Tish?
I have one more item that I would like the board to join with me in. The chairman and the vice chairman and myself had the great honor last Thursday of going to Wilmington when one of our employees was honored. And that's Daphne Graham Dudley. She was honored last week, Thursday, and we went down.
Set up, Daphne.
And come on up, Daphne. And I am really honored. I've worked with Daphne a long time, and we've been through a lot together. And I don't like to do this, but I am going to do this because I was so honored that she was named our tax collector of the year amongst all the tax collectors in Hope County.
North Carolina.
So she was given this. I had to go get it. And I don't do this often, and I always let the board do it. But somebody that works for me gets it. Daphne received this lesson, and I am so honored that you got this, and I thought everybody should join in this, just not us. So come get it before So she received this join with us in tax collector of the year, Daphne.
Yes.
We are the best.
Yes.
I think when she taking over, we was number 99 in the state of North Carolina on this tax. 99 out of 100. That's not good. And now she is the tax collector of the year for North Carolina.
I'm proud for many things. I'm proud of my employees. Number 1, thank you, Daphne.
Number 1 again. We just
Yes. Yes.
better say something, Tish.
I just want to say thank you. I do appreciate it. I don't take this award lightly. There are, not just 100 counties, we also have to count the cities and the towns. So this award to a lot of people in my profession, it means a lot.
Yes.
It does mean a lot. And I thank this board, the new board members, for allowing me the opportunity, the growth that I've had here. I've been here over 26 years
enjoy my citizenship.
Getting ready, my papa getting up, then he hugs her.
You gotta let people talk first. Oh, yeah, I would've wanna go. I wanna go. Oh, here you go to stumbling. Here you go to stumbling. Here you go to stumbling. I'm back the whole board next time.
You go to studying, you know
You
what's
start
up.
stuttering.
All righty, what else you got, Tish?
That is it for me.
That's it for you?
He's going on adjournment now.
Uh,
Reminder about your retreat.
What else, Tony?
I'm gonna do that.
What's next?
That is it for me.
What was that?
I just want to say something out there, but I'll do
No, I'm good.
Mr. Chairman, I just want to just pause for a minute because Scott gave his presentation on behalf of Cape Fear Hospital, and he was talking real fast. I didn't get a chance to say anything, but let me tell you, Cape Fear has been doing an outstanding job for Hope County for a long time. And I think that he gave us this medallion. This medallion says 10 years of service from Cape Fear Valley. And for 10 years, y'all been doing an outstanding job for us. And you, even though you may be affiliated with Cape Fear Hospital, those who wants to go to First Health, you treat them equally the same. And you do an excellent job, and that's really important because you put the citizens first, and that's key. I just want to recognize you publicly on the job you guys are doing. Thank you.
Yeah, 29th, 30th.
Okay. You think ready?
Yes, sir. Thank you.
Any other board member have anything they need to say? The board will be in a retreat the 29th and 30th of this month to our citizen in Hope County. We'll be in a retreat to doing business for Hope County to make sure we continue to grow and prosper and be number one. Ms. Hunt, I give you the honor tonight to make this next motion.
Oh, Miss Hunt, Mr. Hunt, you meant?
Mr. Hunt.
Oh, sound like you said Miss. I was looking for, I thought my wife had moved up in here. Mr. Chairman, I make a motion that we adjourn.
That second?
Second.
All in favor with aye? Aye. Opposed? Thank y'all for coming.
I think he did say this, Tony.
He did, I know what.
I think I heard Ms. Hunt.